Okay, let's dive right into this explainer and tackle a topic that honestly might make you squirm just a little bit. It's definitely something most pet parents would rather not think about, but the reality is it's incredibly common. And more importantly, it's entirely solvable for your furry best friend. Today, we're going through a comprehensive guide on tapeworms in dogs. We'll break down what they actually are, how your dog manages to catch them, and exactly what you need to do to get rid of them and keep them away for good. Right out of the gate, I need you to remember this. If you observe little rice-like segments in your dog's poop, do not panic. Your first instinct is probably going to be to freak out, which is totally normal, but don't. These internal parasites are super common, but our pets just can't fight them off without our help. So take a breath. We're going to walk through exactly how to handle this calmly and effectively. So here is our roadmap for today. First, meet the intestinal tapeworm. Second, the Trojan flea transmission. 3, spotting the sneaky signs. 4th, diagnosis and fast treatment. And finally, number 5, prevention and human risks. Okay, let's start with section 1, meet the intestinal tapeworm. What exactly are these things? Well, a tapeworm isn't just one long, smooth worm like you'd see on the sidewalk after it rains. It's actually made up of a head that attaches to the dog's gut, an unsegmented neck, and then this long segmented body. And those segments, they're called proglottids. That's the part you really need to know about. These segments grow, they fill up with eggs, and eventually they break off. When they pass through your dog's intestine and come out in their poop, they look exactly like small grains of rice. Sometimes they're even moving, which, yeah, is gross, but that's exactly what you're looking at. And to give you a sense of scale, get a load of this number, 4 to 28 inches. Depending on the exact species, these flat internal parasites can literally grow to be over 2 feet long inside your dog. They basically look like a tailor's measuring tape, which is where the name tapeworm comes from. They just anchor their heads right to the inside of your dog's intestinal lining and steal the nutrients your dog is working so hard to digest. Moving on to section 2, the Trojan flea transmission. How in the world do dogs actually get them in the first place? This whole process is essentially a biological Trojan horse. It usually starts with an intermediate host, almost always a flea, carrying the tapeworm larvae. So picture this. Your dog gets a little itchy, right? They scratch, they bite at their fur to groom themselves, and whoops, they accidentally swallowed the infected flea. Once that flea is digested in your dog's stomach, the tapeworm egg is released, it hatches, anchors itself right to the gut lining, and starts growing. Then it produces those rice-like egg segments we just talked about, which pass in the feces. From there, a flea larvae out in your yard eats those eggs, and the entire cycle starts all over again. By the way, outdoor dogs or hunting dogs that might eat infected rodents or rabbits are at a seriously high risk for this too. All right, so we know how they get in. Let's look at section 3, spotting the sneaky signs. What do you need to look out for? The tricky thing is, at first, your dog might not show any major symptoms at all. They're stealthy. But as that parasite grows, you're definitely going to start seeing some red flags. The most obvious one, those dried, rice-like segments near your dog's tail or maybe left behind in their dog bed. Then, of course, there is the classic dog scoot. You know the one, where they drag their rear end across your living room carpet. It's a little comical, sure, but if you see that or excessive licking back there, that is a huge warning sign. In super heavy infections, which are more rare, you might actually see a worm in their vomit, or you might notice unexplained weight loss, simply because the tapeworm is stealing literally all their nutrients. Now for the good news in section 4, diagnosis and fast treatment. Here is how your vet actually finds and fixes the issue. If you suspect tapeworms, please don't try to DIY it. Your vet basically has 2 main ways to figure this out. The first is direct observation, which just means looking at a stool sample under a microscope. But here's the catch with that. Tapeworms only shed their eggs periodically, so if your vet takes a sample on an off day, they might actually miss a totally active infection. That's why the fecal antigen test is such a game changer. It detects specific tapeworm proteins and is usually sent out to a lab. It takes a little longer to get the results back, but it's incredibly accurate, even if the worm isn't actively shedding eggs that day. Once you have a diagnosis, treatment is surprisingly straightforward, but you absolutely have to do both parts of this process. First, treating the worms themselves. Your vet will likely prescribe a dewormer containing an active ingredient called praziquantel. You might see names like Triworm D or Drontal Plus. This usually comes as a pill or an injection, and it works incredibly fast to kill the worms inside the body. But, and this is a massive but, look at the other side of the equation, stopping the source. Giving your dog a dewormer is only half the battle. If you don't use aggressive flea control at the exact same time, your dog is literally just going to swallow another infected flea next week, and boom, you're back to square one.
Which perfectly leads us into our fifth and final section, prevention and human risks. How do we protect the whole family? So this is the question every pet parent thinks about, and it's a scary thought. Can humans catch tapeworms from dogs? The honest answer is yes, but it's actually really rare. You are absolutely not going to catch a tapeworm just from petting or hugging or cuddling your dog on the couch. It doesn't spread through direct contact like that. The real risk applies to humans, especially little kids playing outside, who might accidentally swallow an infected flea from the dog's environment. So because of that small risk, and honestly just for the overall health of your pet, you need to play defense. It is all about breaking that transmission cycle. Strict flea control is non-negotiable. Use the collars, drops, or pills your vet recommends. You also want to keep their bedding and your yard really clean. Avoid feeding your dog raw meat, because that can harbor totally different types of tapeworms. And just practice good hygiene. Dispose of dog waste quickly, wash your hands right after, and make sure the kids know not to play anywhere near animal waste. I want to wrap up this explainer by leaving you with one final proactive question to chew on. Getting rid of the worm itself, that's the easy part with today's vet medicine. The real challenge is looking at your entire backyard ecosystem. You can cure the worm, but are you doing enough to control the fleas that brought it inside in the first place? Definitely keep that in mind the next time you're brushing your dog or checking them over for pests. Stay informed, keep your furry best friends protected, and thanks so much for